Have you ever looked down at your nails and thought, that's new? Maybe a groove, maybe a color that wasn't there last year, maybe a shape that seems slightly different from how your nails used to look. Most of the time, it's nothing at all, but your nails are actually one of the most honest parts of your body. Unlike your skin, which can change quickly, your nails grow slowly and steadily, and because of that, they quietly record what's been happening inside you for weeks or even months. In a way, your nails are like a diary that your body has been writing without you realizing it. In the next few minutes, I'm going to walk you through 4 specific nail changes that doctors watch for, especially in adults over 60. I'll explain what each one can be connected to, what's usually harmless, and most importantly, when it's actually worth a phone call to your doctor. I want to say upfront that this isn't about turning you into someone who panics every time you look at your hands. It's the opposite. It's about giving you enough real information that you can tell the difference between something ordinary and something worth a second look. No scare tactics, no miracle fixes, just clear, calm information. Let's get into it. The first change is called clubbing. It's when the tips of your fingers look a little rounder and puffier than usual, and the nail curves downward over that rounded tip, almost like the shape of an upside-down spoon. If you're not sure what to look for, try this. Normally, if you place 2 fingers together, nail to nail, there's a small diamond-shaped gap where the nail beds meet. With clubbing, that gap disappears because the fingertip has become more rounded. This change tends to develop very slowly, sometimes over years, which is exactly why a lot of people don't notice it happening to themselves. Family members or even a doctor doing a routine exam often spot it before the person does. But here's the detail most people miss. Clubbing isn't caused by anything happening in the nail itself. It's caused by something happening with your oxygen levels over time, often related to long-term lung conditions like COPD or scarring in the lungs, or in some cases, heart conditions that have been present for years and affect how well oxygen circulates through the body. To be clear, clubbing by itself doesn't diagnose anything. Plenty of things can subtly change the shape of your fingertips, and some people even have a mild, harmless version of this shape that runs in their family and has nothing to do with their lungs or heart at all. But if you notice this rounding developing along with shortness of breath, a nagging cough that won't go away, or unusual tiredness with everyday activity, that combination is worth mentioning to your doctor at your next visit. Next is a nail shape that looks almost the opposite of clubbing. Instead of curving down, it curves inward, like a tiny spoon. In fact, in more pronounced cases, you could actually balance a small drop of water in the center of the nail without it spilling. This one is called koilonychia, and it's most commonly linked to one thing: low iron in the body. Here's the twist, though. You don't have to feel anemic in the classic sense to have this. A lot of people picture anemia as feeling exhausted all the time, looking pale, maybe getting dizzy. But some people with early iron deficiency don't feel unusually tired at all, at least not yet. The nail change can actually show up before the fatigue does, which makes it a surprisingly early clue. The reassuring part is that iron deficiency is one of the most fixable things on this entire list, but only once it's actually confirmed with a simple blood test. It's not something to self-treat by picking up iron tablets at the pharmacy, because too much iron in the body causes its own set of problems, including strain on the liver. So if you spot spoon-shaped nails, think of that as a mention it at your next checkup moment, not a run to the pharmacy moment. Your doctor can check your iron levels properly and figure out why they might be low in the first place, which matters just as much as treating it. This next one looks like a ridge running side to side across the nail, almost like a tiny speed bump you'd feel if you ran your fingernail across it. These are called Bowes lines, and they can appear on one nail or several at the same time, depending on what caused them. What's interesting is that these lines mark a moment in time, almost like a scar left behind by a stressful event in the body. Nail growth actually paused briefly, usually because the body was dealing with something significant. That could be a high fever, a serious infection, a period of poor nutrition or unintentional weight loss, a zinc or protein deficiency, or in some people, blood sugar that was running high for a stretch without them realizing it. Even a major surgery or a stint in the hospital can sometimes cause this, but there's a detail worth knowing, and it surprises most people. Because nails grow slowly, at roughly the same rate every month, this groove might reflect something that happened 2, 3, even 4 months ago. So if you see one now, Don't panic about what's happening today. Think back instead. Was there an illness, a fever that knocked you flat for a few days, a hospital stay, or a rough patch a few months back that you'd almost forgotten about? That context matters more than the line itself, and often it explains everything. If these lines keep reappearing with no obvious explanation, though, that pattern, not a single line, is the thing worth discussing with your doctor, since recurring Bose lines can sometimes point to an ongoing issue like poorly controlled blood sugar that hasn't been addressed yet. The last one is called Terry's nails, where most of the nail looks pale, almost white or ground glass in appearance, with just a thin pink or brownish band near the very tip. Now, here's the part I want to be upfront about, because this is where a lot of health content online tends to exaggerate things. This particular pattern is genuinely common in older adults simply from the aging process itself, and in most cases, it's completely harmless. So if this is the only thing you notice, and you otherwise feel perfectly well, please don't panic. That said, in a smaller number of cases, this pattern has been associated with more significant conditions, including liver disease, kidney disease, or long-term heart failure. The distinguishing factor here isn't just how the nail looks on its own, it's whether it shows up alongside other symptoms. Things like unusual swelling in the legs or ankles, ongoing fatigue that doesn't improve with rest, a noticeable change in appetite, or unexplained weight changes. One nail sign in isolation in someone who otherwise feels fine is usually just a normal part of getting older. One nail sign plus other new symptoms is what turns this into a conversation worth having with your doctor. So what should you actually do with all of this information? Let's go through some simple, practical steps. First, check your nails in natural daylight rather than under yellow indoor lighting, which can distort color and make pale or pink tones look different than they really are. Once a month is plenty, there's no need to inspect them daily. Second, take a photo every few months. Nail changes happen slowly, and a photo from a few months ago is a far more reliable comparison tool than trying to remember what your nails looked like before. Third, look at the whole picture, not just the nail in isolation. Ask yourself, is this change happening completely on its own, or is it showing up alongside fatigue, breathlessness, swelling, or appetite changes? That context is often more useful than the nail sign by itself. Fourth, remember that common, harmless causes exist for almost every nail change on this list. Nail polish, especially darker colors worn for a long time, can temporarily stain or discolor nails. Minor trauma, like stubbing a finger, can cause ridges or lines. Fungal infections can change color and texture without any internal cause at all. Cold hands can temporarily affect nail bed color. And simple aging changes the look and texture of nails for almost everyone eventually. Most of the time, one of these ordinary explanations is exactly what's going on. And fifth, if you do notice something that concerns you, write down when you first noticed it and whether anything else has changed in how you're feeling. That small bit of information can make your doctor's visit much more useful because they can look at the full timeline instead of just one snapshot. I want to be really clear about something before we wrap up. Everybody's body is different, and nails can vary a lot from person to person for totally ordinary reasons, including genetics, hand use, past injuries, and simply how someone's body ages. What's unusual for one person might be perfectly normal for someone else. This video is general health information, meant to help you understand what these signs can mean, and it's not a diagnosis, and it's not a substitute for seeing your own doctor. Nail changes can look similar to each other, and only a proper exam and sometimes blood work can tell you what's actually going on. If you notice a nail change that's new, that's sticking around for weeks, or that's showing up alongside other symptoms, the right next step is a real conversation with a real clinician who can actually examine you in person, not a guess based on a video and not a search engine. Your body has a lot of quiet ways of getting your attention, and your nails are one of the more overlooked ones, tucked away at the ends of your fingers where most people never think to look closely. You don't need to become anxious about every little change you notice from now on. You just need to know what's worth a second look and what's simply a normal part of living in your body for 60, 70, or 80 years. If this kind of practical, no-nonsense health information is useful to you, consider subscribing. I put out videos like this regularly, built to help you stay informed without the fear-mongering that so much health content online seems to rely on. Thanks for spending this time with me today, and I'll see you in the next one.